Welcome to the Patient Assessment Medical Skill Station. In this skill, you will have 15 minutes to perform your assessment, patient interview, and voice treat all conditions discovered. You must conduct your assessment as you would in the field, including communicating with your simulated patient. You may remove the simulated patient's clothing down to his or her shorts. As you progress through the skill, you should state everything you are assessing. Specific clinical information not obtainable by visual or physical inspection, for example, a blood pressure, must be obtained from the simulated patient just as you would in the out-of-hospital setting. You may assume you have two partners working with you who are trained to your level of care. They can only perform the interventions you indicate necessary, and I will acknowledge all interventions you order. I may also supply additional information and ask questions for clarification purposes. Do you have any questions?
I do not.
You respond to a 52-year-old female who called 911 because she thinks she has the flu. She is sitting in a chair on your arrival.
BSIP, my scene is safe. So my nature of illness is called for a patient that is just having the flu and wants to be checked out. Number of patients is one, as I can tell. And so I'm not exactly sure what's going on yet, but just to be safe, I'm going to go ahead and request additional EMS. Considering C-spine, here's my patient sitting in a chair, hasn't fallen. Have you fallen or hit your head? Okay, so I don't need to consider C-spine. Just to get a feel of what's going on and get a general impression. Can you just tell me what's going on? My name is Isaiah. Can you tell me what's going on?
Yeah, I just have a really bad dull pain right kind of in the middle of my chest.
Okay, all right. And so level of consciousness, determining that my patient is speaking, she's alert, she's conscious, and it appears that your chief complaint is, your main complaint is chest pain. Mm-hmm. Okay. I'm going to go ahead and airway, breathing, circulation. Airway-wise, her airway's patent. She's speaking to me. It's open. Breathing, I can see chest rise and fall from here. And then circulation, I'm going to go ahead and check a pulse rate, radial pulses.
Her pulse is 64 beats per minute, and you note that her skin is pale, cool, and diaphoretic.
Okay, that's concerning. So as the pulse isn't, it's a little low and it's kind of borderline. And with your skin being pale, cool, and diaphoretic, with the chest pain, all those combined, I'm going to make an immediate transport decision that we need to transport you as soon as possible. I'm going to go ahead and ask you a few questions. Just when did this start?
About 2 hours ago.
Okay. All right. And is there anything that makes it feel better or worse?
No.
Okay. And can you describe what it feels like?
Just the pain really in my chest.
Okay. And is there any specific types of pain? Is there like tearing, pressure, anything like that?
Just a lot of pressure.
A lot of pressure? Okay. All right. Is it a pain going anywhere else besides your chest?
No.
Okay. And if you had to rate the pain 1 out of 10, 1 being minor, 10 being the worst pain you've ever felt in your life?
I'd say about a 4.
Okay. All right. And has this ever happened before?
It happened before, but I was just sick for a few days and then it went away.
Okay. All right. I'll note that. Do you have any allergies?
I do not.
Okay. And do you take any medications?
Just for high cholesterol.
Okay. So have you ever had any, besides the other time where it was similar and you were just sick for a couple days, have you ever been to the hospital? The doctor ever told you that you've had a heart attack?
No.
Or anything like that? Okay. And you've never been hospitalized for any longer period of time?
Mm-hmm.
Okay. When was your last oral intake?
About 2 hours ago.
Okay. And so events leading up to it, when this happened, what were you doing?
I was actually just moving some furniture when it started to really hurt.
Okay. All right. So I'm going to go ahead and move on to my secondary assessment. And I'm going to start that by getting a set of vital signs. Place the blood pressure cuff. And I want to also take the blood pressure.
The blood pressure is 142 over 82.
142 over 82. Okay. And then can I get a pulse rate?
The pulse is 64 beats per minute.
Okay. Can I get breath, breathing rate and quality?
She's breathing at 20 times per minute, normal chest rise.
Okay. And can I connect SpO2?
She's setting at 97%.
97. Okay. And then I want to go ahead and connect leads and get a ECG.
You note that she has normal sinus rhythm on a 3-lead ECG.
Okay. I want to go ahead and connect and do a 12 lead.
The 12 lead shows that she has elevation in leads V1 and V2.
Okay, so that's just telling me that I have a possible septal MI or myocardial infarction. So that's my field impression of the patient is a possible MI. I want to go ahead and give this person, I don't need to give them oxygen. They're satting at 97%. I will have it available if it need be. I also want to establish IV access, but I want to give 0.4 milligrams of sublingual nitro, and I want to give 481 milligram aspirin for a total dose of 324 milligrams. And I want to reevaluate at every 5 minutes and to see if there's any response to the nitro. And I also want to activate the cath lab at the receiving facility and perform another 12-lead ECG prior to arrival.
You get the same ECG with elevation in V1 and V2, and your repeat vitals are blood pressure 146/82. She's breathing at 20 times per minute. Her pulse rate is 62, and she's satting at 98%.
Okay. And I want to continue treatment evaluation.